Good morning, Dr. Tedros.
Good morning. Good morning. How are you?
Very good. We're very good. We
Uh,
are great. There are over 8,000 nurses in this hall cheering your appointment and congratulating you.
Thank
And we
you.
are,
Muchas gracias and buenos días. I was in Barcelona in 2004. What a beautiful city. Moltas gracias for having me. Thank you. Thank you so much. Muchas gracias.
truly a beautiful city, and the hospitality of the Spanish Nurses Association has been wonderful. The nurses in this room come from over 135 countries, and we all work very hard together to advance nursing. So we are very eager to hear your words. And without taking any further time, I am handing it over to bring your greetings and your comments, and thank you for being with us.
Thank you. Thank you so much again. Moltas gracias again. Thank you. First of all, I would like to thank Your Excellency for that very brief introduction, and thank you also for your willingness to include me in one of your final sessions. I'm sorry that I'm not able to join you in person. I really love Barcelona. I would have loved to be with you. It's such a great honor to address you all as the Director General elect of the World Health Organization, as well as from the perspective of someone who has worked throughout his entire career to improve access to health services. This is such an important forum filled with representatives of the 20 million nurses globally working to achieve exactly that goal. I want to start by thanking you all for your services and your invaluable contributions and sacrifices at the front lines of healthcare systems around the world, and your leadership at all levels, from transforming policies to saving lives. Your service and leadership are essential to increasing access to quality and affordable health care around the world. And I have had the great fortune to see the impact of nurses firsthand in Ethiopia and elsewhere. I have seen the commitment of nurses as they pack their bags and their families and head to some of our world's most remote corners. In those acts, nurses ensure even those living far outside of our urban hubs are connected to health systems. I have seen the way nurses can ease the lack of access to complex interventions like cesarean sections through task shifting and task sharing with physicians and other providers. I know how tightly linked nurses are to communities, creating opportunities for them to educate and empower individuals so they can affect their own health outcomes. And finally, I have seen that no matter what country or community nurses are working in, they almost always end up taking on a role beyond health, be it in educating communities about water and sanitation, in referring a patient to the social support services they need, or ensuring they have transport to and from appointments. In these ways, as we all clearly recognize in the A Voice to Lead initiative, nurses are key to achieving not just health related sustainable development goals, but all the sustainable development goals. Related, as some of you may know, my top priority as Director General of the World Health Organization will be achieving universal health coverage, a topic I know has been an important priority for this year's Congress. And it's fitting exactly with my vision statement. First, I firmly believe universal health coverage is the right thing to do. Globally, as you know, an estimated 400 million, approximately 1 in 17 people, lack access to health services. That's unacceptable, and we must do something about it. Prioritizing universal health coverage can also help us tackle the triple burden of disease, communicable and non communicable diseases, as well as health emergencies. Indeed, we have seen where health systems are strong countries are better and able to manage all three. And I believe the world stands at a unique moment to drive progress on universal health coverage, because we not only have the technical evidence to achieve this goal, but also the political will necessary to make it happen. I'm actually really glad universal health coverage has been a focus of this year's Congress, because there is no doubt in my mind that nurses are a linchpin of this effort, regardless of whether you're from a developed or developing country, one that's high income, middle income, or low income, one that landlocked, coastal, or a small island nation. We all need a strong, sustainable nursing workforce to achieve this goal. Nurses are the foundation of our ambition to universal health coverage. That's what we should believe. Your role in transforming our health systems to ensure everyone can lead healthy and productive lives is indispensable, and everybody should know that. On that note, I want to close with a bit of a call to action and a commitment from me, and I'll ask your commitment too. As Director General-elect, I call upon you to join me in our quest for universal health coverage. I hope I can look to all of you in this room and the International Council of Nurses to be a partner in our effort to achieve this ambitious yet attainable goal. In return, I promise to support your efforts and listen to your inputs, because you are very essential partner. And to ensure this is the case, firstly, I promise to keep my pledge of having a senior level staff person representing the nursing community to represent your voice at WHO headquarters. Secondly, I commit to have regular dialogue with your leadership. Your perspective and voice is essential in the work of WHO and in how we build the support systems necessary at the local, regional, and global levels to reach universal health coverage. All roads should lead to universal health coverage, and your role is essential in achieving universal health coverage. Thank you all again for the opportunity to address you today and for all the work you do, big and small things. You're indispensable, and I commit to work with you and focus on the two issues I have already outlined. I look forward to our partnership. Thank you so much again for this opportunity. Moltas gracias. Thank you.
Thank you, Dr. Tedros. I am not sure if you can hear the room exploding in recognition and applause, and particularly for the pledge that you make to honor your commitment that you have given us. I want to tell you that we are all standing, including ICN, leading the charge with our wonderful CEO, Dr. Francis Hughes, and the incoming president, Annette Kennedy, and all of the nursing associations in the world to work with you, because yes, our commitment is the health of the 7 billion in the world, and there will be no health without nurses. And nurses are committed to do that. So we are looking forward to meet you very soon. And yes, we want a senior nurse on your team, but we want to nurses involved in every program in Geneva and in the regions, so we can deliver on the Sustainable Development Goals and for universal health coverage. Thank you.
I agree with you. No health without nurses. No. And I commit again, not only at the headquarters level, but to have your involvement at all levels. And I know the differences you can make. And that's why I believe in you. You're a force that can really change this world. I believe in you. And actually, I believe in me because I believe in you. I believe in us.
Thank you.
Thank you so much. Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank you very much.
Okay.
Okay, I wish you all the best. I wish you success. Look forward to working with you very closely. Thank you so much. Thank you.
I look forward to myself and the President being a regular feature in your diary.
Thank you. Thank you. Will do.
care. All the
Will
best.
do.
Take care.
All
All
the
the
best.
best.
Moltes gracias. Thank you. Thank you so much. Bye-bye. Okay, that's done. Yes.